makes you so sick at heart that you can't take part. You can't even passively take part.
An article that was published in the Journal of Intensive Care Medicine and authored by Dr. Pierre Kory has been retracted due to errors in the data. Now, I'm sure you've probably heard at some point of Dr. Pierre Kory. He is a very controversial doctor who has been a leading proponent of alternative therapies for COVID, including a certain horse dewormer that, due to YouTube censorship, I will not name. But let's look at the retraction. Remember, retracting an article is a big thing. It's not done without significant evidence of, erroneous conclusions or data manipulation or whatever. So the name of the study is the Clinical and Scientific Rationale for the Math Plus Hospital Treatment Protocol for COVID-19. That is one of this was, I think, probably the first COVID treatment protocol that Pierre Kory developed. This was before. This is a 2020 article. So this was before other alternative treatments like horse dewormer were proposed. So yeah, the data from Centara Norfolk General Hospital were presented in Table 2, which lists in-hospital or 28-day mortality rates at the two Math Plus centers as compared to 10 published single-center and multi-center reports. The mortality rate among 191 patients at Centara Norfolk General Hospital as of July 2020 was reported as 6.1%, as compared to mortality rates reported in the literature ranging from 15.6 to 32%. The authors state that this data, quote, provide supportive clinical evidence for the physiological rationale and efficacy of the Math Plus treatment protocol. Unfortunately, the data is inaccurate. We conducted a careful review of our data for patients with COVID-19 from March 22, 2020 to July 2020, which shows that among the 191 patients referenced in Table 2, that the mortality rate was 10.5% rather than 6.1%. Now, this doesn't look like a huge difference, but read on. In addition, of those 191 patients, only 73 patients received at least one of the 4 Math Plus therapies, and their mortality rate was 24.7. Only 25 of 191 patients received all 4 Math Plus therapies, and their mortality rate was 28%. So the average of 10.5 was actually was dragged down by the people who got dragged up rather by the people who got these therapies. That is crazy. So there is no, they're not claiming that this was done deliberately. I suspect it was, because everything in Dr. Pierre Kory's career suggests that this guy is a complete fraud. Now, I just want to show you the original article. Yeah, so this was published relatively early in the pandemic, in August. It was originally received in August. And I want to just show you the controversial Table 2, which is down. There we go. So what they're doing here is they're comparing mortality rates from some other studies that were done in the UK, US, and China. And all of them show, kind of an average about a quarter, 25%-ish mortality, kind of ballpark figure there. Remember, this is the mortality rate for hospital stays, not for the general population. Obviously, if you get sick enough from COVID that you require admission to the hospital, your mortality rate at that point is much, much higher. So these numbers look almost miraculous. So there is one set of patients from the United Memorial Medical Center in Houston. Their mortality rate was allegedly 4.4%. And then this is the people from the Centara Norfolk General Hospital, where their mortality rate was 6.1%. So yeah, in comparison, this looks, borderline miraculous. But as we can see, that was not the case. And I have no doubt that the data from the United Memorial Medical Center was also fudged in some way. I await the moment that this information is revealed to us. I'm sure they are all already checking the data. So now here's the problem with Pierre Kory. He is one of the co-founders of a very controversial group called the Frontline COVID-19 Critical Care Alliance. And this is a group of doctors who have basically just been promoting alternative therapies uh, and treatment protocols for the disease, and they've done some pretty good marketing. Uh, so much that Dr. Pierre Kory has appeared at Senate hearings. He has appeared on the Joe Rogan show. He is sort of the go-to doctor for the anti-vax community, because according to him, you wouldn't need a vaccine if you take any of his treatments. And what are those treatments? Well, the protocols that they're promoting are still this very much discredited Math Plus treatment, and these other treatments that start with an I, and you can guess what that I means. Yeah, this. And none of this has had any kind of definitive clinical evidence. That's a fact. There is no evidence that this works. And when you log into the site now, like, this is just massive cope. Like, their first article here is Dr. Paul Marik, who's the other co-founder along with Kory. Patients at Centara Norfolk General Hospital are dying needlessly. Lawsuit filed as hospital handcuffs doctors' ability to save dying COVID-19 patients. In a press release issued today, the FLCCC announced that its co-chief medical officer, Dr. Paul Marik, filed suit against the Centara healthcare system for instituting a policy preventing him and other physicians from administering proven life-saving treatments. Quote, "We take an oath as doctors to do no harm," quote, said Dr. Pierre Kory. No doctor should be forced to watch their patient die knowing that more could have been done to save them. Well, this all sounds very noble, and you can say, well, maybe he genuinely thinks this works. Well, but if you don't have evidence that it works, then you're just, whether you're a doctor and whether you've taken an oath, that doesn't, permit you to apply a treatment that doesn't have any evidence that it works, unless you're clearly doing this experimentally and you receive authorization that you're going to try an experimental treatment. But you as a doctor can't just come to a patient and say, I still think leeches might work, or a medieval blood transfusion, just because I genuinely think it might work. I don't know, that's just not how things are done. I don't play Bloodborne for a couple of hours and then think a blood transfusion is going to save people. So this is massive cope, but and they're still promoting it. The math. There's just no shame, and they know this because the people who follow them are people who are just completely blinded to any form of belief in actual data, belief in actual science, and just believe these nutters because they're saying what they want to hear. And they're just feeding into their anti-vax sentiment. So again, this is despicable because these people have been platformed on a national and global level. Pierre Kory has been on the freaking Joe Rogan show. What he says has been promoted endlessly by people like Rogan. And then whatever Rogan says ends up being promoted further by all his networks of comedians and celebrities and internet pundits, and this is what basically poisons people's minds. So, but if you don't believe me, you can always support their work with donations or buy some of their clothes. I'm sure you will all look great in this Horse Dewormer Saves Lives t-shirt or whatever it is. Yeah. This is really, really sad. But I am glad that this study was retracted. It's a bit of a shame that this study was not one of the ones related to horse dewormer, because that would have been even more embarrassing. But still, it goes to show that this is a dishonest actor who, just because you have a medical degree and you're a practicing physician, does not mean that you can't be a complete quack. And that's why it's very important to identify these people, identify what their ultimate grift is, and if necessary, bar them from practicing medicine, which I generally think someone like Pierre Kory should be barred from. This is not a free speech issue. This is like a saving lives issue, okay? When you have a physician like like Andrew Wakefield, the guy who published that fake article about vaccines and autism, the guy who literally started the whole, like, the modern anti-vax movement. These people have been barred from practicing medicine, and I think people like Pierre Kory also should have the same standard applied, because these people are killing others. And yeah, so, you know, take this as evidence that this guy is a fraud. And yeah, please, 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 if you haven't done so, please get vaccinated. It works. It could save your life. Just, you know, just do it. We have a responsibility for ourselves and for others. And right now, you know, maybe in the future we will, you know, there's a couple of COVID pills coming into the market soon. Maybe we won't need to be endlessly vaccinated for the rest of our lives. If we get COVID, we'll just pop a pill in. Which I should add, there's more evidence that pills can screw you over than vaccines. But you know, fine. If what you don't want is to get a shot, then hopefully once these pills arrive, you won't need to. But in the meantime, the only effective way to prevent you from getting COVID is a vaccine. So please, please get it. And on that note, thanks for watching this video. If you liked it, please give it a like, please give it a share, and more importantly, please subscribe to this channel. And I'll see you next time.